So scooting forward, starting alignment.
Feet on the ground.
Knees, right? Starting in midline, right? Shoulders over hips, weight right on your sit bones, so I'm not flexed, I'm not leaning forward. I'm right on them. Hands and weight bearing. So for those patients, or for those subjects, including me, whose arms are shorter than their trunks when I'm sitting up tall, what you would want to do is build that up with books, or we got those right. We got depression blocks, right. So you want a little bit of elbow flexion, just like if you're fitting someone with a walker or crutches or anything. You want how many degrees of elbow flexion?
20 to 30.
20 degrees of elbow flexion, right? And you want that so they can depress and use that, right? So I'm here. So let's just talk about scooting, what that movement is. So the first part of scooting is a frontal plane motion, and what I'm going to do is I'm going to shift my weight onto my right pelvis, let's say. Okay. So what do you notice? So it's frontal plane. So I shift so the first movement is a weight shift. So I'm doing pelvic depression on one side and elevation on the other, right? And what do you notice about the relationship between my shoulder and my sit bone or my hip when I'm shifted? Where is it? Is my shoulder out to here? Or is my spine curved in the frontal plane more?
B.
Curved in the frontal plane more. Did you catch that? Okay, and you're going to feel it when you do it on yourselves, you'll feel it in it. So I'm curved in the frontal plane more. It's just enough that I can get some clearance under this sit bone, and then I'm going to rotate my pelvis in what direction to scoot forward?
Forward.
I'm going to rotate my pelvis forward, and that's going to translate my femur
Forward.
in the sagittal plane, right? And then I'm going to re-weight that side. And then shift my weight to the other side, elongate on this side, lateral curve, right? And then this side is free, and then I'm going to move this forward. And shift and move, and shift and move. So tell me what the spatial direction is. So what's spatial direction for this? Frontal.
Front.
And spatial direction at the pelvis?
Transverse.
Spatial
Transverse.
direction at the pelvis. Transverse. Spatial. Ooh, trick question. What's the spatial direction at the femur?
Sagittal.
Sagittal. Okay, and now I'm reversing it. So now I'm elongating on the left side.
Frontal.
Frontal.
Transverse.
Pelvic rotation.
With sagittal translation.
Scooting. How cool is that? So what you need to know is you don't have to lean and lift your leg up. Keep your feet on the floor, and you can just move your pelvis. Or if you can get someone to do that instead of, right, you're gonna have a really mobilized patient if they can do that, right? So what do you think? What if you have limited lateral motion, segmental motion at your basically at your lumbar spine and your trunk? What do you think? Where do you think you'd initiate from? Probably over. You lean. Okay. What if you were stuck in flexion and you couldn't get into extension? Where would you initiate from? Probably your upper trunk and your shoulders, right? That makes sense to you guys? So precept really does influence. So as